Hello, my name is Michael Villanueva and I am a clinical psychologist here at the Alpha Theta Center, where we do brain mapping and neurofeedback, and we do a lot of EEG research and analysis. I wanted to talk about COVID-19. Over the past month or 2 months now, I have learned a lot about COVID-19, much more than I expected, and I want to talk about some of my observations that we've seen here in the center and seen with the people that are post-COVID, and kind of share some of my thoughts with you and opinions. This is nothing like the flu. I'm not a medical doctor, nor have I done controlled studies on COVID-19. But as I said a moment ago, my opinions are just based on our observation here and what we've seen. So we've all heard that COVID is a respiratory disease, and I used to think that, and I used to think, well, it's not like the flu, it's just another type of flu. I no longer think that. COVID-19 is no more like the flu than cancer is an infectious disease. From my direct observations with clients, we have seen an incredibly confusing, diverse set of symptoms. And we see it in their histories too. We see extremely physically active people with absolutely no histories of panic attacks or dizziness, now reporting confusional states and kind of shifting in and out disorientation, short-term memory loss, gastric distress. We've seen, although it's correlational, people that have been diagnosed with POTS, which is postural orthopedic tachycardia, after having COVID, when it was nothing like that before. We also know from the scientific literature that COVID can infect cells outside of the respiratory system. And this is vitally important because when these cells get infected, we now know that the immune system can mount an extremely strong response. And that strong response, that in of itself, can cause dizziness and seizures and tremors and confusional states. So we really are seeing all sorts of different stuff. Like, I think it's even reported loss of sense of smell and taste. And when you place into this mixture that 30% or 33% of all hospitalized COVID patients show signs and symptoms of delirium, which is an acute confusional state, you have a real toxic mixture here. And when you think about being ventilated on a mechanical ventilator, oftentimes, in fact, I think it's almost the norm that you're physically restrained. You have people coming out that experience this delirium, having altered states, hallucinations, being restrained. So you have, it's really, as I said a moment ago, very toxic combination of PTSD-like symptoms, panic attack, you're out of breath because you walk down a hallway. Why? Because of the respiratory infection? So my personal opinion on this is what makes me think. This is what makes me think that COVID-19 is more of a whole body disease. There was an extraordinarily interesting piece of research done not so long ago that suggested that the inner linings of the blood vessels and capillaries, there's a certain name for that cellular arrangement. It begins with an E, and I can't even pronounce it. I apologize. But in the brain, that system perfuses blood through the cortex by gently opening up. And by opening its diameter, it creates a negative pressure, which pulls blood in through the brain. Well, if the brain is being differentially affected in different regions by blood profusion, this could certainly account for a lot of the symptoms that we are seeing. If you've had COVID-19 and you have a host of cognitive symptoms 2 to 3 weeks after you have recovered, memory, problems with memory or confusion, then I would suggest getting a brain map. We can take a look and see at what areas of your brain may not be functioning efficiently, and we can possibly do neurofeedback. That might help. Secondly, if you've not had COVID, then I would strongly urge that you get a brain map somewhere from any provider that is competent to do so. That type of pre-information, when compared with post, say you got COVID and you recovered, would be extremely valuable in knowing what areas might have been directly affected by the virus as opposed to what areas are basically you being who you are, right? So a pre-map would be incredibly helpful for any provider to help you out and to make a recovery plan. Thank you. Thank you for watching this video, and thank you for being concerned enough about what COVID is to maybe get another set of opinions. Very much appreciate your presence here.